Have you ever wondered why patients with hypertension or high blood pressure is usually associated with the condition of obesity or overweight and diabetes? So hang on, we're going to discuss about these things because this might affect you, friends, and family members. Primary hypertension is usually diagnosed in the midlife where patients' blood pressure is over 120/80. Hypertension in itself does not give you a problem. It is the end organ damage of hypertension that is deleterious to your health. For example, if you have chronic exposure of high blood pressure, your pressure is here 130 or 140 in the arm. Imagine the pressure that is there in the arteries supplying the kidney or the renal arteries. This thickens and eventually it scars and decreases the blood supply of this nephron or the cell of the kidney. And eventually, slowly, these kidney cells will die. And then eventually you'll develop chronic kidney disease associated with hypertension. And usually, if you have hypertension, there is a metabolic component that is related to sugar and that develops also diabetes. So these are linked. That is the recipe or the qualification for the entry into a different syndrome called metabolic syndrome, which has a higher risk of heart attack and stroke compared to individual in itself with hypertension and no diabetes or diabetes without hypertension, or the healthy obese without hypertension or diabetes. Let's define secondary hypertension. Tumors from the adrenal glands that produces norepinephrine and adrenaline, like pheochromocytoma, or tumors of the adrenal gland that produces cortisol, like the Cone syndrome, and diseases of the kidney that is exemplified by polycystic kidney disease. And there are so many other more. We don't have to discuss that. But let's focus on primary hypertension. The main cause of primary hypertension or essential hypertension is the defect or the hyperactivity of the sympathetic nervous system. Sympathetic nervous system is the fight-flight reaction of the autonomic nervous system. It is spontaneous. It does not ask permission. The autonomic nervous system is innervated by the vagus nerve. Vagus nerve, vagal tone, which is the supply from the tip of your hair to the tip of your toe. You want your vagal tone to be in the parasympathetic tone, which is essentially when you talk about vagal tone, you're talking about the parasympathetic system where you're resting and digesting. Now, the innervation of the autonomic nervous system is the vagus nerve. It's a long nerve that comes from here around the neck to the abdominal area, and it's embedded in that cage there, the thorax and the abdomen. That's why it is sensitive to deep breathing and breathing. That's why you're almost like massaging your vagus nerve when you're doing the deep breathing. Exhale. Inhale, 4. Hold. Exhale. 8. Hold. Because this activates the vagal tone. When you inspire, your heart rate goes up. When you exhale, your heart rate goes down. That is the variation that is needed in your respiration or your heart rate in relation to the respiratory rate. You always have this irregularity in the rhythm of your respiration. That's what you call respiratory sinus arrhythmia or irregularity in the breathing. And that is the beauty of nature, because if you do recruit this variation of your heart rate in relation to respiration, that activates the heart rate variability, the higher heart rate variability that is correlated to the state of parasympathetic tone. So what I'm getting at is that essentially in the treatment of hypertension, it is important that you do guided breathing. 4, hold, exhale, 8, and hold. This will recruit your vagus nerve. It will tone your vagus nerve, but you have to exercise this regularly, as if like when you're building muscles, you have to exercise and tone that muscles. Tone. You have to do that every day. That helped me when I had a sympathetic overtone from sleep deprivation. The sympathetic overtone is usually activated by, number 1, sugar. Well, sugar increases when you're sleep deprived. How? Number one, you have the propensity to eat a hedonic appetite for junk food, the sugary, high fructose corn syrup, the very sweet, and the salty food. Number two, when you have sleep deprivation, your cortisol level goes up. That's the stress hormone. The end effect is that the cortisol increases the sugar and then again stimulates the sympathetic tone. When the cortisol is also activated, or the sympathetic tone is activated, it also activates the adrenal gland to produce norepinephrine and epinephrine. These two specific substances are very important in the control of blood pressure because these epinephrine and norepinephrine constricts the vessels from the brain to the tip of your toe, causing the constriction and eventually increasing the blood pressure. When you're sleep deprived, cortisol level goes up, most likely your blood pressure goes up. And it's very common. I have patients who behave this way. I have a 94-year-old friend of mine who could not sleep for some reason. He was preoccupied subliminally with something. And sure enough, like last night, I have to deal with this patient. His blood pressure went up to 220. Immediately, this patient could have been brought to the emergency room and treated overnight. And what I did, I made him breathe in and out slowly. And I also treated acutely the blood pressure with medications that is usually what I would give. Hydralazine, which dilates the blood vessels. And of course, I keep an IV hydralazine in case hydralazine by mouth cannot control it. When I went there last night, his blood pressure was 220. I gave doses of oral hydralazine given every 4 hours. And then when the blood pressure still was still up above 180, I gave hydralazine, put him to sleep. This morning, his blood pressure was 124/80. But of course, I encouraged him to do the guided breathing. I said, Father, do you have any problem? Are you preoccupied with something? He said, no, not in my mind, but I know there's something going on. There's always this subliminal thinking, something you worry about, something that you cannot share. This happens all the time. For example, you are preoccupied with caring of somebody. Imagine how many times your sympathetic tone is harassing your body, including the hippocampus and everything in your body. But eventually you can develop this fluctuation of your blood pressure, labile hypertension, and sometimes you develop this what you call neurocardiogenic syndrome. This happened to my patient, chronic caregiver. And this patient was tried on different types of medication. ACE inhibitor, angiotensin receptor blocker, beta blocker like losartan or metoprolol. Nothing helped her. This mechanism of high blood pressure will not respond well to this kind of medication. For years, 3 years, she went to the cardiologist, internal medicine doctors, and finally she came to me. But I was just blessed. I was thinking the mechanism of her blood pressure is sympathetically overtone derived. The drug of choice for this are those medications that tone down the sympathetic tone, if it's pharmacological. I chose clonidine, and I chose clonidine patch so that you will have a good level through the day. Of course, you can use oral clonidine, but it's unreliable because of the absorption. You have to believe what happened to this patient. Remember, she was suffering, she was getting depressed, she would cry because she would feel so lightheaded. Her blood pressure fluctuates, her blood pressure goes down, which takes the blood pressure, and then it goes up again during the time when the drug wanes through the day. I gave her clonidine that day, patch. Started with 0.1. The following day, she said, Doctor, she was bawling of joy. She was crying. Doctor, thank you very much for bringing back my life. And she's still around here now. But if you think about the mechanism of high blood pressure and not just give them medications right away, then it would be better for the patient. And of course, she started to do guided breathing in and out. And we have the luxury here, really luxury in Ave Maria, that we have a 24-hour adoration. And she started adoring, doing the meditation. She goes to Mass quite regularly, in fact, every day. I know that for the fact, because I see her every day. But I think what matters was the meditation and also the clonidine patch. Another case is a 38-year-old man who had a trauma. Unfortunately, he had to be, making long story short, it was so traumatic for him that his blood pressure went up. prior to him coming to my office, his blood pressure shot up to 220. That's hypertensive urgency or emergency by definition. If you have end organ damage, if your kidney is damaged, then it becomes hypertensive emergency. Well, he went to the emergency room, given medications, came back, still not feeling good. Blood pressure keeps on coming back and forth. The treatment of high blood pressure or hypertension has to be comprehensive, holistic. You have to take into account the focus of sympathetic overtone. How can you decrease the sympathetic overtone? How can you switch the sympathetic tone to parasympathetic tone reproducibly and in long term? This is what I did to the patient. I continued the blood pressure medicine. He responded 130, but it was not enough. It has to go down to 120, less than 120 over 80. Because, as I said, the end organ damage is associated with blood pressure more than 120. That's what I call a prehypertension or stage 1, depending on which academy you go to. Well, this particular patient responded well, but things we did really better. He started to do guided breathing and meditation. And with him, he responded to doing, when he inhaled, we use the Jesus prayer. When he inhales 4, hold at the back of his mind, quietly, he says, Jesus, Son of the living God. When he exhales, he says, have mercy on us sinners. Inhale, Jesus, Son of the living God. Hold, have mercy on us sinners. I will demonstrate to you in another short video about this. He exercised. He loves biking. He loves biking with his father-in-law. He went biking again for a long time. He was hesitant to go exercising because he got lightheaded. He got uncomfortable feeling. He definitely stopped sugar, anything that was sweet, the bread that converts to sugar, the pasta, the white potatoes. These are high glycemic index food. And we switched him to more fibrous food, like 2 cups of vegetables twice a day. His bowel movements got better also, and he was nourishing himself. He lost weight because he didn't have much of appetite. Remember, appetite can be suppressed with expansion of your stomach. That is the reason why you need fiber, so that the fiber, when you drink also, the fiber becomes expanded, so that the expansion of the stomach will signal the hypothalamus to say, I'm not hungry anymore, the leptin, as opposed to the ghrelin, which is so hungry. Even if you eat 2,000 calorie worth of donuts, that will not cut or suppress the appetite because you don't have fiber. The stomach is still there in a hungry mode. That's why you need fiber, you need nuts, you need fluid. So one of the mechanisms of that would be, or a way of curtailing your appetite would be drink soup before, or drink water or juice before you get your first bite. And then eat your salad first before you eat your main dish. Let alone, if you have dessert, just a little bit. That will help you. That will help you lose weight. Well, the first thing I measure is the waistline right here. For example, this is the hip area here. You put a measurement that is parallel to the floor. That is the waistline that you should follow up, not the weight. Because weight usually is very unreliable in terms of monitoring your progress. Because you can gain weight from gaining muscles from your exercise. But the most important thing is the waistline. That's where the active fat is, the visceral fat. You monitor that. For male, white, it has to be less than 35. For Asian male, it has to be less than 30, 33. It is a very significant marker of metabolic derangement. And that is the first focus of your weight loss program. Peptide helps, like tirzepatide that I use, monitored closely, very safe, because it acts on 4 different mechanisms. You will decrease the waistline first, and eventually the blood pressure goes down also, together with, not just because of the waistline decreasing, but your exercise, which increases your serotonin, the vasodilators also increases, norepinephrine and epinephrine goes down. Everything would just be in a very healthy, well state. He slept better because of his exercise, and he fasted. The first thing he fasted was not to starve, but he got rid of his sugar. The glycemic index food, like bread, pasta, white potatoes and switched to fiber, as I said. We supplemented him with trace minerals, especially magnesium, because magnesium helps also maintain the level of potassium. Where potassium is low, your blood pressure goes up. We also corrected his vitamin D, which also helps the metabolism. We corrected the trace minerals and the antioxidants, vitamin C and glutathione levels, hopefully to reduce the inflammation, because inflammation is fed and will feed more inflammation. So hypertension cannot just be dealt with pill. Hypertension, the center of treatment is meditation. And I say again, meditation. And if you consider meditating with his unconditional love of Jesus, the unconditional love through his passion, because he loved us so much, it is truly overwhelming, and you will have a peace greater than the ocean. That's his promise, as he revealed to Saint Faustina in Poland. Meditation, together with guided breathing, fulfills the meditation that is actually comparable to the Eastern meditation. The Buddhist, the Hindu meditation is focused on breathing. That's self-centered. That's pride. That is the friend of our enemy, the devil. That's why you do not use the meditation of yoga and meditation if you're Christian, because that is self-centered pride, and it allows entry of those enemies, and it should be Christ-centered meditation. You can do the Jesus prayer, the chant for the Divine Mercy chaplet, or even the Rosary, thinking about the mysteries of the Rosary as a mindfulness exercise. And the rhythm, the Hail Mary, gives the pulse of your breathing together that will switch your sympathetic tone to parasympathetic tone. And guess what? Your soul will also rejuvenate. Essential hypertension or primary hypertension is easily treated with lifestyle change. That means diet, exercise, sleep, supplements, and meditation. You will be more close to Jesus. And all those things that needed to be close to Jesus, adoration, confession, and all those corporal mortifications will just combine. This is how you treat hypertension in a Catholic way or a Christian way. This is Dr. Raul Linad from Cadenza Medical Clinic. I hope you like this video, and if you do, please drop a comment. Raise some questions so we can discuss. Please share. There might be some other people who would benefit from these podcasts. And wait for the next episode of the podcast to continue our series for medicine and faith. Thank you very much.